The Birth Circle podcast features experts in all the nuanced areas of pregnancy, birth, and postpartum with the aim of helping women make the choices that will keep them safe, healthy, and empowered. We respect all birth choices and believe in supporting informed consent and evidence-based practices. Nothing said on this podcast should be taken as medical advice. You should always seek the advice of a competent professional for your care. Welcome to the Birth Circle podcast.
This is Sarah with Birth Circle, and today I'm so excited. I have Julie Tupler with me, and we are going to talk about Diastasis Recti. And this has been fascinating me forever. Even when I was a new mom, I didn't know what it was. I didn't even know what to Google. Do you Google, Pointy tummy syndrome? I have learned so much in learning about the Tupler technique, and I'm excited to have Julie on the program. Thank you so much for joining me today, Julie.
Thanks for having me.
So just a little bit about your background. You're a registered nurse, you're a childbirth educator, and a certified personal trainer. And you developed a fitness program in the 1990s. So you've been working with pregnant women for over 30 years.
Right. Well, my first 20 years, and then in 2009, I reinvented myself so that I could teach the program to men and children as well. Still pregnant women, and also to prepare people for abdominal surgery to prevent incisional hernia, which is when the stitches come undone after surgery. I mean, people prepare for shoulder surgery and knee surgery, but for some odd reason, there's no preparation for abdominal surgery.
Wow.
So that's a, and with pregnant women, it's very important to keep the diastasis smaller because it can put a pregnant woman at risk for an unnecessary C-section. Because when the muscles separate, the uterus then tilts forward,
yes,
and the cervix is pointing sideways instead of downwards.
Wow. Okay. Yeah. I cannot wait to ask you all the questions. But your Tupler technique, that is researched and evidence-based, and it's a way to close that gap. So the diastasis recti is when your muscles in your stomach separate. And if you've ever experienced this, listeners, and you've flexed your tummy after giving birth and it goes to this really absurd pointy alien shape, that is the separation of the muscles. And that stuff coming out, that's your guts, right? Because your muscles have separated. Is the pointy part your guts?
Yes. Yes, that's what it is.
Yay!
Those are your organs moving forward, because when the muscles separate, the connective tissue between them stretches sideways and becomes like a piece of saran wrap. So then your organs really don't have a great support system.
Wow. Okay. And so you could also get this if you're a man or a child, right? So we all know this pregnancy, but how do people develop this problem?
Well, pregnancy is a major cause, and it's usually worse with pregnancy because what happens during the pregnancy is that the body creates this hormone called relaxin, and that really softens the connective tissue. So if people have taken steroids, they would have the same effect as well on their connective tissue. So basically, on that connective tissue, you have a belly button right in the middle there. And that's a weak spot in the connective tissue. So you keep on putting a forward or a sideways force and stretch on this, the muscles are going to separate. Everybody's born with their muscles separated. Then around 3 years old, after the nervous system develops, usually it comes closer together. But because there's that weak spot in the connective tissue, you put force on it, it separates. So if a child is really constipated, if the baby has low muscle tone, like Down syndrome, if the child does gymnastics where they're arching the back all the time, swimming, tennis, these things all can puts force on it and can separate it. But gymnastics is a one that
a big one.
Is a big one.
So could you have this damage done as a child but not recognize it until you have babies, and it would just be
Exactly.
worse?
Exactly.
So how can you tell in like little children if they've got that?
Oh, well, you can check them and see that little doming when they come up and they don't have a lot of, they have difficulty getting up. All right. You have an outie belly button is a sign of it. So, so these are signs of a
Got
diastasis
it.
in a child.
Oh, I
They have
thought the
bloating
outie
after
belly.
eating.
Oh, bloating after eating.
Yeah.
Okay. Yeah. And that would be in adults too, right?
Yes, absolutely. Because you have muscles here, and when you eat, your organs move forward. That's the bloating.
Okay. Wow. All right. So tell me, you launched into it, but I want to go back in detail now. How does this affect? Well, first of all, would this affect fertility? Would this affect the way your organ sits, your uterus sits in your abdominal cavity? Would this affect periods? Would this affect?
Well, if you have it, the uterus is going to be tilting forward. All right.
Okay.
That's the side effect of the diastasis. So, so if it's facing sideways, it might be a little bit more more difficult to get pregnant, but having a vaginal birth is going to be very difficult with a sideways facing cervix. So,
Mm-hmm.
and if your uterus is tilted, sometimes it could probably cause more menstrual cramps, the position of the uterus.
Got it. Okay. So then in labor, okay. So I know you don't notice it when you're pregnant, obviously, because your
Well,
belly. No, you
well,
do? Okay.
you do notice it because if you started the pregnancy with the diastasis from whatever cause, from doing
Mm-hmm.
crunches, from doing gymnastics, from doing being in a car accident, having abdominal surgery where they blow your belly up with air, any of those things, if you start the pregnancy, you will show much faster. The second pregnancy, you're going to show even faster because you're going to be more separated. And
Got it. Yeah.
then the deal comes with the pushing. All right. So pushing is very difficult if the muscles are separated and you try and engage them, they move this way. And with pushing, the muscles have to move front to back to put pressure on that uterus. So the muscles have to go back, and then the pelvic floor has to be open and relaxed. That's what we teach is how to push with the abdominals, relax the pelvic floor. But if the muscles are moving sideways, then what happens is you don't feel the muscles working. Right? So you have
Oh,
to bring them together so that they move in the front to back direction. All right. So it's going to be much more difficult to push in labor.
yeah. I've heard
And
some women who've had multiple babies, it gets harder. Every labor gets harder.
it gets harder and harder.
Mm.
And then what happens is with pushing, if you push incorrectly, like holding your breath and bearing down, besides popping blood vessels in your face, besides making your diastasis bigger, and the worst thing about Valsalva is the effect on the pelvic floor. All right. And the effect on the pelvic floor is causing any kind of uterine or any of the other organs to prolapse, to come down outside the body. All right. And you don't want
Oh,
that. All right.
no.
With my pushing technique, if you engage the abdominals, and to be able to engage the abdominals, they have to be close together. All right. So they would either hold a scarf to keep the muscles close together to be able to push effectively. But if you push effectively, it's going to prevent using the transverse abdominal muscle, knowing how to do it, practicing it
Oh
during
my
the pregnancy,
goodness.
so that you know how to push with the abdominals, relax the pelvic floor, and you don't have all those issues on your pelvic floor. The incontinence, the
Wow.
prolapses, the hemorrhoids, all that is not the badge of courage or whatever they call that.
Nope, nope, nope,
That
nope.
could be avoided.
It's because your
Avoided.
muscles were wonked and you weren't pushing correctly because
That's
you
right.
couldn't because
That's right. That's right.
so I've seen people use a rebozo where they'll wrap it around the mama's tummy. She'll be on hands and knees. They'll wrap it around and they'll pull up, and that helps her push. And so that's kind of helping those muscles come back together, even though they've already separated.
Well, it's if they're just wrapping around, it's more like a compression,
Mm.
it's not, you have to manually pull the two halves together. It has to be pulled together. Just wrapping it is not going to have the same effect.
Okay, so what holds these muscles together then?
Well, I have developed the Diastasis Rehab Splint. But when I first started working with pregnant women, and they always saying, "Oh, I can't feel this, Julie, I can't feel it." So then I took a scarf and I pulled the muscles and I had them pull, and they go, "Ah, now I feel it." So once we brought them closer together, they were able to feel the muscles working front to back. So my splint, my Diastasis Rehab Splint, I have 2 models. One is for short torso, has 2 arms, and one is regular, has 3 arms. And when you put it on, you move the muscle and the connective tissue, and then you attach the splint. So it's different than compression. Compression is going front to back. We're just bringing it close together
Interesting.
so it can move front to back, if that makes any sense.
Okay, so if you bring the muscles together, then is there connective tissue in between that needs to be strengthened, and that splint lets
Well,
that
there you
connective
go.
tissue heal?
So when we reposition, we're repositioning the muscles so they work correctly, and we're repositioning the connective tissue. So if this is a muscle and this is a muscle, okay, and this is the connective tissue in between, when we reposition the muscles, we're also repositioning the connective tissue. So we're putting it in a narrow position. All right. And what we're wanting to do is take the stretch off that stretched out connective tissue and put it in that narrow position. That is the best position to do the exercises. That's the best position for it to heal. Just like if you broke a bone, you what? Continuously put the 2 ends so it fuses. So we want to continuously keep this connective tissue in this narrow position. So every time you engage the transverse, it's in that narrow position, and that's the position that it's best to heal in.
Got it. Okay, and so could you heal okay. So many questions. So while you're pregnant, you could be doing exercises to prevent this from happening, right?
Absolutely.
But then
Absolutely. What? I was doing 6-week maternal fitness classes, and we would check the diastasis week 1 and then again in week 6. And what we were discovering, and one of the physical therapists that was teaching my class said, "Oh my God, the diastasis is getting smaller as their bellies are getting bigger." And I just trained 2 trainings ago in my professional training, a yoga instructor, and she was here in New York. So I checked her myself, and she had, was starting her 2nd trimester, and she had a 6-finger diastasis, and in 3 weeks, she brought it down to 3 fingers and she maintained it. So the muscles can stretch without separating. All right. They don't have to. The only thing is that the doctor then, or the midwife, is going to think that the baby's low birth weight because the belly looks smaller when the muscles stretch when they're closer together. So you just have to tell your doctor or midwife that you're doing this program, and that's why your belly is smaller.
I've seen videos of women that will be really look pregnant, and then they'll do something with their muscles and they're pull the baby up and in and almost look like 2 months less pregnant than they are. And they're just engaging those abdominal muscles in a way, like relaxing them or engaging them. And people with diastasis, they cannot do that, right?
Well, they have to, again, if the muscles are really separated, right? And these are the outermost recti muscles. And the function of these muscles is to support the back and support the organs. And it actually supports the upper body and the lower body as well. But when they separate, they're not doing their job. It's this weak connective tissue. But as I said, when you look at the muscles under ultrasound and they're 4 fingers apart or more, all right? And when you have that doming, you got 10 fingers in there, okay? At least 10 fingers.
Yeah.
Okay. So when you have that, as I said earlier, the muscles move this way. You can't feel the muscles working because they're doing this. You have to manually bring them together so that you can feel them working. Then when you engage transverse, the action of the transverse is forwards and backwards, and that's connected to the outermost muscle. So it brings them back, but they have to be close together to do that. I hope that makes sense.
I think so. I think it's still biologically, or I don't understand how the muscles work. And you're saying, but it's clear when you say it's compression is in and out, and you're
So compression is front to back. The muscles move front to back. Okay. But they can't move front to back if they're separated too far.
Yeah. Oh, yeah.
They move side to side.
So then what's a sit-up? What is it? What is a sit-up doing if you have diastasis?
Uh, Well,
Okay.
what it's doing is making it, well, a sit-up or a crunch either makes it worse or creates it. So I could create a diastasis on myself if I started doing crunches, because it's in a back-lying position when the shoulders are off the floor. It's physically impossible to engage the transverse. So if you're not able to engage it, it moves forward. And when the muscles move forward, it brings the connective tissue with it, stretching it, okay? So the muscles are working in the wrong direction, because when you want to strengthen a muscle, you want to shorten it. So if they're moving forward, they're getting stretched, and the connective tissue is getting stretched with it. And that
Ouch.
just makes it worse.
So all of
All
us
right?
doing sit-ups as teenagers trying to get that cute little six-pack, we are all giving ourselves diastasis.
That's right.
Great.
That's right.
Fantastic. Okay.
That's
All
right.
right.
I did it myself. I had one.
I'm like, well, my daughter's in tumbling and they do sit-ups all the time. So, but you said that gymnastics does that to you. Okay,
Mhm.
so then you have your clients wear splints, and then do you have certain exercises that they do while they're wearing the splint?
Yes. So my program progresses over 18 weeks. And the big picture of the program is that I'm working to strengthen that connective tissue between the two separated muscles that's stretched out, so it then becomes strong enough to hold the muscles in a close together position. That's the goal of the program, okay? Is to, heal that connective tissue and make it strong enough to hold the muscles in a close together position. I do that 3 ways: by repositioning muscles and connective tissue, which I just mentioned, with the wearing the splint, and then in week 4 of the program, double splinting, which is wearing 1 or 2 and then holding another scarf. Strengthening the muscles and the connective tissue with my Tupler Technique exercises, and protecting the connective tissue from getting stretched either in a forward or sideways direction. The program is 4 steps. Step 1 is wearing the splint all the time. Even when you sleep, take it off 15 minutes to bathe, and then clean and dry your belly button and put that splint back on, okay? And you wear the splint until the connective tissue is strong enough to hold the muscles in a close together position. The exercises is step 2. Um, we we start with seated exercises the first 3 weeks, and then in week 4, we do the head lift. And then in week 6, once the transverse muscle has been strengthened, I teach a diastasis safe workout.
Mm.
So the program progresses over 18 weeks, but how long it takes to close your diastasis depends upon the severity of your diastasis and your commitment to doing all 4 steps of the program, and doing it my way, not your way. Um,
I love that. You could say that again. I won't mind. Yep, because we all think, well, okay. So my next question is, how do people know? Because I knew after my babies were born and I would flex and I'd have a pointy tummy. But now, 10 years after my last baby, I don't have a pointy tummy anymore, but I have the symptoms you described, the bloated stomach after eating and stuff like that. So how would somebody tell that they have a diet? Because after talking to you earlier, I went and looked and I can't feel my muscles. I can't decipher if I have it or not.
okay, well, you probably do.
Yep, probably. Yeah,
You
that's
probably do. So what happens is that when people lift their head to check the diastasis, the muscles come together. So then you're checking it at its smallest. So I don't have my clients lift their head anymore. I go on either side of the abdominal muscles. I check one side and then the other side with like 8 fingers to see. And then I add the 2 sides together. I mean, it's not
mm,
an exact science, checking for diastasis. I have people check the circumference of their body, because as the diastasis starts getting smaller, the circumference gets smaller. And
but you're not
um,
losing weight, but you're just getting tighter.
right, you're getting, and then
Yeah.
I have my clients take their before belly pictures from the front and the side.
And those are fascinating. If you're listening to this, head over to her website. We'll give you the domain later. But those pictures are fascinating because you can tell it's not a weight loss photo. You can tell it's muscular.
It's definitely muscular. When you see somebody that's had a tummy tuck, And then you see the people that have done my program, because when they're doing a tummy tuck, basically they're just sewing, they're putting that connective tissue in a narrow position and just stitching it up. All right. And I've had
That's
many people have that stitching come undone because they didn't know how to use their abdominals correctly after the surgery.
or they
So
have
they
another
end up,
baby and it blows it right open again.
yeah, right open
That
again.
sounds great. That sounds fantastic. Oh.
Well, and then you're cut from hip bone to hip bone. So you have a huge scar from hip bone to hip bone. So it's always best to do my program first to see, to either prepare for the surgery, or if you do it, you might not even need the surgery. Either way, it's a win-win.
Yeah. Okay, so I want to back up a little bit. How did you get started in all this? I mean, this is you're very specialized. Your Dr. Oz called you an expert in this. So, how did you get so
Well,
specialized?
I was teaching exercise at a health club when I first moved to New York. And they said, you're a nurse, you should teach. This was in the late 80s. They said, you should teach a prenatal exercise class. So, so there was nobody doing prenatal. There was like Elizabeth Noble, and I took her class, and I didn't really agree with what she was doing. So I said, well, I'm going to have to create my own class. So I started teaching, and then I realized the people in the class found out I was a nurse, and they started picking my brain about labor. So I became a childbirth educator and realized that childbirth education comes at the end of the pregnancy and only prepares your mind. And you wouldn't run in a race and not train. Why would a woman do the hardest thing she's ever going to do, labor, and not have that mind-body connection?
Mhm.
So that's how I got started with preparing women for labor. And then I started maternal fitness in 1990. And then in the process, I saw that thing and I go, what is that? All right. And I just started studying it because I wanted to know what it was. And the aha moment came when one of the ladies said, I can't feel these, I can't feel this. So I took a scarf and I pulled the muscles together and I said, how about now? She goes, yep, I can feel it now. And she was like so happy because then she could do
Mm.
it. So I'm thinking, all right, I'm going to have everybody hold those scarves. And then in 2001 or two, I developed the splint, and it's been an ongoing process of updating it and making it
Interesting.
better.
Yeah, yeah. And so have you been able to see then you mentioned sonograms, ultrasounds. You've been able to see via ultrasound what this technique does for the muscles,
Yeah, I
right?
have
Yeah.
many physical therapists that I have trained that use the ultrasound with the program, and they say, yeah, that's how the muscles move. That's how I know that because
That's
I
so
work
cool.
with physical therapists, and um, they use it. I don't use the ultrasound.
Yeah.
Um,
Okay, so the main message here is go ahead and go buy her program. But but what would you say would the most important thing for a woman when she's just starting pregnancy, first, second, third trimesters where the muscles are not being stretched yet? What are some of the things she could do to prepare her body?
Okay, first trimester, we tell our pregnant ladies, because normally they're nauseous and not feeling well. But if they're feeling okay, to just, when they do the exercises, just hold the splint. You can start wearing it in second trimester.
So you can actually wear
Because,
the splint during pregnancy.
right, right. A second trimester, we recommend they starting it after the major organs have developed, the nausea has stopped, because we want to make sure everybody puts it on correctly. Um, so that type of thing. So yeah, and then every time they go to the bathroom, they can practice the pushing using their abdominals back, pelvic floor open and relaxed. So with pregnant women, I do have a perfect pushing video. As part of my program packages, all my program packages come with support because um, my program is much more successful with support. So there's an online support program where each week there's a video, each week there's tips, and each week on Fridays, I do a live webinar, and I talk about a different topic each week about the program, whether it's the exercises or posture or belly breathing or putting on the splinter, the diastasis safe workout. And I usually takes, maybe sometimes 30 minutes, sometimes 40. Then with the remainder of the time, people can ask me questions. They're recorded. So if they can't watch them at that point in time, they can, they're inputted on the online support program. There's a little folder with them. If they can't make it and they have a burning question, they can submit their questions Friday morning, and then I'll answer them at that webinar on Friday. So people are much more supported, because I don't have trainers in every place. I mean, obviously the best way is to have somebody hands-on, but second best is, doing the program with the online support program.
Mm-hmm. Very, very cool. And then how late can you repair this? I mean, I'm 10 years past my last baby. Am I?
Well, let me ask you something. If a man's 50 years old and he can repair his, can you repair yours? Of course.
Yep.
It's
Okay.
all about strengthening that connective tissue. Doesn't matter how old you are or when you had it. It just, it matters about the how weak your connective tissue is. The weaker it is, the longer it's going to take you. That's all. You're still going to have benefits. You're going to see the changes within the first 3 weeks. You're going to see the changes with your circumference. You're going to see the changes in the way your belly looks. So you're going to see the changes if you do the program. I was just at a networking event and they said, if you had one thing to tell your clients, what would you say? And I would say, do it my way.
Not your way. Yeah.
Do it my way.
Don't
Because
think you're smarter than the
finds
program.
loopholes, well, what if I do this? What if I do that? What if I do that? You have to do it the way I said.
Got
and
it.
then you'll get the best results.
Okay, so I've got a weird question, and maybe you won't know the answer. It's okay, but I want to kind of combine two things that I've learned recently. So you have the diastasis, but also there's insulin resistance, which adds circumference. I like how you say that so diplomatically. It adds circumference. So how do you know when you have a diastasis and when it's actually just you've got a problem with insulin and you're just packing on the pounds right there?
Well, the diastasis doesn't only shows up in the belly. You look like you have a bigger belly.
Right.
All right. So you would have other signs. Now you could have the insulin resistance and the diastasis.
And that's
right?
the big,
but you would see with the insulin, you get the weight in other places. With the diastasis, it's just in the belly.
just in the belly.
Just in the belly.
Got it. Okay, so really quick, I know you glossed over it, but tell me more in detail. How does this make a woman more at risk for a C-section?
Okay, so if these are my muscles, right? And what's the function? The function is to support the back and support your organs. So when they separate, the connective tissue stretches sideways. So if this is my uterus, this is my cervix, these are my muscles here. All right. When they separate, the uterus, then the top of the uterus tilts forward. So now the cervix is pointing sideways. All right.
Your cervix is pointing to your back, because the midwife told me I had an anterior cervix, but that's the same thing.
Right. It's pointing sideways instead of downwards, lined up with the vaginal canal. So it's pointing this way. The baby's going to go right out to the wall of the uterus. There's no way. You have to bring the muscles together to get the uterus to stand up straight.
And so that it harder.
Right.
Makes it harder for the baby to descend because it's.
Yeah. Well, they can't descend because it's facing this way.
It's facing your back. Way. So then would that be you're more likely to have a posterior baby?
Well, you're more likely to have a C-section.
Because your failure to progress, your labor just isn't progressing.
Well, it can't progress. Your cervix can't open up because there's no pressure on it and because it's going sideways.
See,
It's facing this way instead
what you're
of that
talking
way.
about is so different than what any midwife or OB or anyone has, talks about. So that's why I'm trying to if someone says we're going to give you a C-section because failure to progress, that's their language. I'm trying to take the way they would describe it and connect it to this
Well,
diastasis problem.
the failure to progress could be because of that. I mean, there's certainly other factors.
Right.
There's certainly other factors, but this is definitely one of them.
Got it. So if they,
Because there's no pressure on the cervix. And even if there was pressure on the cervix with the baby doing this, kicking on the this, right? They're still not going to, there's no way to come out because you'd have to get the cervix pointing downwards.
Okay, so what if you're listening to this at 35 plus weeks and the damage in this pregnancy has been done and labor is coming up soon? What do you do?
Well, it depends, you might want to, well, it's a tough situation if you're at the end. The only thing that I could suggest would be to take a scarf and like pull the two halves of the muscles together, right? And see, if that helps put the uterus in a better position. That would be the only thing. But you have to have an awareness of how to use the muscles. It's not, you can't, it takes about 21 days to learn a new skill. So that's why I say every time I make my pregnant women swear that when they're having a bowel movement, they're going to think about me. I tell them I get a lot of job satisfaction knowing that they're thinking about me at this precious moment in time. But you have to practice that skill. Put your feet up on a little footstool so you're in a squatting position, supports and aligns the bowel, and then you bring the abdominals back and then relax the pelvic floor when you're going to the bathroom. I don't want you to tighten the abdominals and tighten the pelvic floor.
Okay.
Right? So it's sort of like keeping the cap on the toothpaste. Because you see on the cover of my Perfect Pushing, you see a baby coming out of a tube of toothpaste. So I do that image of pushing is like squeezing toothpaste out of the tube. So here's my toothpaste and my abdominals go back and the baby like toothpaste comes out the bottom. But you have to practice that. You have to practice that.
I know. How do you know if you're feeling it right or not? But you're saying with the split and with your technique, that'll all make sense.
Yeah.
Yeah. So does the diastasis affect like round ligament pain, back pain,
Well, back pain for sure. Back pain for sure, because what's the function? The function is to support your back.
Mm-hmm.
I was at a party once and I was the entertainment for the party. There were 30 people at the party and I checked everybody for a diastasis and everybody there had one except for me. And there was one 18-year-old that had horrible back pain. She'd been to every doctor. She was 18, bone thin, chiropractors, acupuncture, and then they were giving her antidepressants. Not one person checked her for a diastasis. She had like over a 10-finger diastasis from doing crunches and from doing gymnastics as a child. So horrible back pain. Horrible.
Basically.
So if somebody goes to a doctor or a chiropractor for back pain, and as part of the evaluation, they don't check them for a diastasis, their treatment plan is going to be incomplete because that has to be ruled out as one of the causes for the back pain.
So this really needs to be a fundamental foundational discussion about your health.
Yes. Somehow the medical professionals have not connected the dots with the side effects of diastasis.
Yeah, I'm like, how could we be in this century and not have connected this? It's not even like, like leeches, bloodletting. It's not even woo-woo. It makes so much sense that if your front muscles aren't supporting your back muscles are going to get tired and your bones things are going to go out of place. It's so logical.
Well, out of place is right. So you get back and hip pain, and if you have pelvic floor issues, unless you deal with the diastasis, the pelvic floor isn't going to do well. All right. You see the older people that are rounded over with the big bellies. Mm-hmm. I can't help those people because once they're rounded over, I can't, approximate the muscles. So you got to, I said I can, if it's ever too late, when they're in that condition, if you're rounded over like that,
Like
I can't help you.
like your back is rounded over.
The back is rounded over, yeah,
Mm-hmm.
because I can't have them wear the splint or even hold a splint. I've tried it. Doesn't
Because
work.
yep, it doesn't work. They're not straight anymore. Wow. Okay. Well, tell us how we can become, all the listeners can find all of the things, your books. You've written 3 books. Let me read those really quick. You've written Maternal Fitness, Lose Your Mummy Tummy, and Tummy Together Tummy. Those are all on
Yeah,
Amazon,
well,
right?
Lose Your Mummy Tummy is not in the market anymore because as the more I teach this, the smarter I get. So Together Tummy is an update of that.
Perfect. And you have got videos. Seriously, go stalk her. Go watch everything on your website. One of the things I loved about your website is that it's so transparent. You can just get lost in there, clicking and watching videos and learning more and more and more. You have so much free content on your site. And then
Yeah,
go ahead.
and then I do, if people really want to, at the beginning of each month, there's an opt-in, like you can get my little Tupler tips. And then when you get the Tupler tips, it says, take a little mini course. And on the mini course, I do at the beginning of each month. I talk about checking for diastasis. I talk about the 4 steps of the Tupler technique, and I talk about a diastasis safe workout. So you get a big picture as if you want to do the program, and then there's an irresistible offer at the end of the course that you can get a very good discount on
Cool.
one of the packages.
Very, very
So
cool.
that's basically, if you want to learn more, you can
And
do
actually
that.
fix it. This is a at home thing. You don't need to go to a trained
No,
specialist. You
no,
don't
no.
need to take a
You
class. You
can,
just,
because I have people, but you
yeah,
can do it
but
on
you
your
can do
own.
this
And
on,
every
yeah,
week
that is so
I'm
cool.
there to answer the questions at my live webinars.
Yep. Yep.
Every week.
And I just want to give a really quick disclaimer that I'm not being compensated at all for this podcast. This is not an advertising thing for the Tupler technique. I just found this and I thought this is a resource we have to look into. This is a resource that has to be more well known. So I'm really grateful that you took the time to help me understand a little bit more about your technique and our listeners.
I'm always thrilled to talk about this. I mean, I talk to people at the
Yep.
post office. I talk to people, if I'm talking to
Uh,
my insurance
the
people,
person stuck
Spectrum,
next to you on the
Verizon.
plane.
How many people at lunch, whoever I can,
I love
that I
it.
hear people talking about oh, you're preg, congratulations.
Have you have you thought about your diastasis? I love it. Cool, cool. Awesome. Okay, well, thank you so very much. I really appreciate your time.
Oh, it's my pleasure. I'm always, this is a condition that most people have and just don't know they have it.
Yep.
So diastasis needs a place in the sun.
It
You
needs a
know,
place in the sun.
right.
And
It
it
needs,
explains so many problems and it sounds so easy to fix as long as you follow the rules. And
it is easy.
yep, yep. Wow. Cool. Thanks for giving us all hope that our pointy tummies could be healed.
Well, can I tell you one more story?
Yes.
So one of my clients, she swore to me that she was going to do all 4. She was going to do it exactly what I said. So in 18 weeks, her and she's actually on the website. I think she's the second to the bottom. She had an umbilical hernia. She reversed it. But she said even before she had children, she had this little belly. And she said after doing my program for 18 weeks that her belly has never looked so good. And her husband is now buying her lingerie. So you can
Mm.
imagine how happy I was about that when a woman is getting lingerie. Um, it's great.
Yeah.
It's great.
Yeah, it really is. And again, not only solving the physical problems of backache and incontinent of pelvic
But
floor
but
issues,
but
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 also
but the way
the
you feel
confidence.
about yourself,
Yeah, the
the way
confidence.
you feel about yourself, and it's on all the covers of the magazine, flat belly, this, and then I look at all this stuff for diastasis, and they're having doing leg lifts and coming up and doing all these things, and I'm going, first of all, it's very difficult to work the transverse in a back-lying position. So I only strengthen it in a seated position first. And I only put somebody back-lying in week 4 after they've strengthened it. And we also do a warm-up beforehand so that they know how to use it in a back-lying position. So there's a lot of stuff out there that's, not, that's not helpful. Let's just
Yeah,
say.
not helpful and actually damaging.
Damaging, yeah.
Yeah, cool. Well, thank you. Thank you. Really appreciate it.
And thank you for having me.
Please visit us at birthcircle.com, join our Facebook groups, or find us on Instagram and Pinterest. We hope you'll use our resources to support your birthing experience.